Regulation of blood pressure. Baroreceptors are important in the short-term control of arterial pressure. Activation of the baroreceptor reflex allows for rapid adjustments in blood pressure in response to rapid changes in posture, blood volume, cardiac output, or peripheral resistance. Baroreceptors are stretch receptors located mainly in the carotid sinus and aortic arch. These receptors are stimulated whenever there is distension of the vessel wall, so they discharge at an increased rate when the pressure in these vessels rises. The threshold for eliciting activity in the carotid sinus nerve is an MAP of 50 millimeters of mercury. Maximal activity occurs at MAP of 200 millimeters of mercury. Afferent fibers from the carotid sinus form carotid sinus nerve or Herring's nerve, a branch of glossopharyngeal nerve. Afferent fibers from the aortic arch form the aortic depressor nerve, a branch of the vagus nerve. Afferent fibers end in the nucleus of tractus solitarius, NTS, in the medulla. Vasomotor center. The vasomotor center is located bilaterally mainly in the reticular substance of the medulla and lower third of pons. The vasomotor center consists of sensory area or the nucleus of tractus solitarius, vasodilator area or depressor area or caudal ventrolateral medulla (CVLM), and the vasoconstrictor area or pressor area or the rostral ventrolateral medulla (RVLM). The ninth and tenth nerves carrying impulses from the carotid sinus and aortic arch baroreceptors terminate in the sensory area, the nucleus of tractus solitarius. Glutamate-secreting excitatory fibers from the nucleus of tractus solitarius project to the caudal ventrolateral medulla (CVLM) or the depressor area. Vasodilator area or depressor area or caudal ventrolateral medulla neurons (CVLM) project to the RVLM, inhibiting the sympathetic outflow. Neurons of RVLM project directly to sympathetic preganglionic neurons in the intermediolateral IML horn of spinal cord. Stimulation of the RVLM increases the sympathetic discharge, which in turn increases heart rate and force of contraction. Also causes arterial constriction and venoconstriction, resulting in an increase in blood pressure, venous return, and cardiac output. The vasomotor area is closely associated with the cardioinhibitory area in the medial portion of the vasomotor center. The cardioinhibitory area or the nucleus ambiguus and dorsal motor nucleus of vagus send parasympathetic impulses to the heart, decreasing heart rate. Glutamate-secreting excitatory neurons from the RVLM or the pressor area project to the intermediolateral horn, IML, of the thoracolumbar cord. IML controls the sympathetic outflow to the heart and blood vessels. Cholinergic preganglionic sympathetic fibers terminate in sympathetic ganglia and the adrenal medulla. Postganglionic sympathetic fibers to the heart and blood vessels secrete norepinephrine, which results in an increase in heart rate, force of contraction, vasoconstriction, and an increase in blood pressure. Epinephrine from the adrenal medulla causes an increase in heart rate and force of contraction. Factors affecting the activity of RVLM or pressure area. Direct stimulation, carbon dioxide, hypoxia. Excitatory inputs. Carotid and aortic chemoreceptors strongly stimulate the RVLM, but only when the MAP is below 80 millimeters of mercury. Cerebral cortex, example, stimulation of motor cortex via hypothalamus. Limbic cortex via hypothalamus. These fibers are responsible for the blood pressure rise and tachycardia produced by emotions such as stress, sexual excitement, and anger. Posterolateral portions of hypothalamus. Lateral and superior portions of brainstem reticular substance. Pain pathways. Inhibitory inputs. Carotid sinus and aortic arch baroreceptors. CVLM. Cortex via hypothalamus. Anterior portion of hypothalamus. Lung inflation afferents. medial and inferior portions of brain stem reticular substance. Baroreflex. Stimulus, increased arterial pressure. Receptor, baroreceptors, carotid sinus and aortic arch. Afferents, Herring's nerve, ninth nerve, from the carotid sinus. Depressor nerve, 10th nerve, from aortic arch. Center, vasomotor center. Efferent, sympathetic nerves, decreased activity. Vagus, increased activity. Effector organs, heart, blood vessels. Effects, decreased heart rate, decreased contractility, vasodilation, resulting in decreased cardiac output and decreased resistance.